Good morning. Thank you for joining us. This is Jill Weishart, and I work with Visagen Global. And today I want to introduce you to Dr. John Gerdes, and he's going to be talking to you about the new FDA Water Safety Modernization Act and how it is affected by your water and what's going to need to happen. So let me tell you first a little bit about John before I let him go further in this presentation. John has been a microbiologist for over 30 years. He has his PhD in microbiology, and his research and work has always been in pathogens relating to water and food illness. So he really knows a lot about what's going on. He's been paying attention to what FDA is doing and sitting on a lot of the webinars. And so we wanted to make sure that you kind of had a more layman's approach from someone who understands what happened with this new act that started on January 26th, how you as a farm have to comply, and then how we need to move forward. So let me take this and take the opportunity to thank John for doing this. It's Dr. John Gerdes, and he will now give you information. If things are talked about that are a little bit over my head, I may stop him along the way just to kind of entertain you and to see if we can get all the information you may need. So thank you, John.
Thank you, Jill. This is John Gerdes, and I appreciate the opportunity to discuss the Food Safety Modernization Act, which is abbreviated as FSMA. So through this presentation, I'll probably be calling that FSMA. And specifically, the part of that law which relates to produce safety, the produce safety rule. And as Jill mentioned, that was effective on January 26, 2016. So the clock is ticking in terms of complying with the law. So what we're going to try to discuss today is, what does that mean to you? Are you covered? What do you need to do? And how can we help at Visagen to make it simple? Just a few words about Visagen Global. Visagen Global is a company that I started specifically to develop a new test that is going to allow farmers to test their water right on the farm. Right now, samples need to be transported to a laboratory, and that takes time. So my goal and objective as a company is, I have concepts that I'm going to develop that will enable that on-site testing. But it's going to take me several years to get that developed. So in the meantime, we have developed a program which we call the Water Profile, and we hope that will be helpful to you in terms of complying with this act. And then ultimately, when I have my product available, the same program will allow you to import the data from the test I'm developing. So what is the FSMA law? And who is required to comply, and how can the water profile that I just mentioned from Visagen help you? So that's what the agenda is for this presentation. And you'll notice on this slide in the lower right-hand corner, there's a link. And because it would take way too long and be way too boring, I'm not going to cover every part of the law. We're going to emphasize the water testing aspects of this law, but you need to be aware that there's other things that are in this law, and the FDA is developing, training and sites for you to help you, and that's the link on the bottom on the right-hand side there. So you can go there for further questions, or the best thing would be, we'll have on our website a blog, and you can certainly ask the questions there. If you have any questions that come up, please send those in to us, and we will either answer them or tell you where you can get them answered. Colorado is somewhat unique in that our water, for the most part, is clean, and clean water is absolutely critical. It's critical to everybody in the community. It's critical for you because if you don't have clean water, we will not have sustainable agriculture because of the risk that might happen if you're using water that is not that is contaminated. It's also obviously critical to recreational activity and impacts food safety, and all of this has an impact or a potential impact to human health. So it's a community system, and the whole environmental system it's critical that we maintain that. So let's talk a little bit about why the FSMA regulation became a law, just to sort of understand, why somebody is forcing this down on you. It turns out that 1 in 6 Americans get sick every year, and up to 50% of those illnesses have been traced to contaminated produce. So it is something that happens. It's not frequent, but 1 in 6 Americans is pretty significant. The agricultural irrigation and processing water has been identified as one of the causes of the contamination. And the reason for FSMA then is it ensures that the grower understands his water. You need to understand your water just like you understand your land. It's critical that you know your water system. And if you're using surface water, for example, which is out of a river or a stream, that can vary. And so it's not going to be a consistent risk. It needs to be something that's monitored. So you need to understand that to direct appropriate water use management. The law places an emphasis on preventing infections by establishing a science-based minimum standards for safe growing, harvesting, packing, and holding of fruits and vegetables that are being grown for human consumption. So each one of those aspects has slightly different compliance requirements in terms of if you're growing or that you're harvesting or packing and holding fruit or vegetables. The FDA estimates that compliance with the FSMA law will result in about a 60% reduction in contamination from agricultural water, and the consequence of that is about a $477 million cost reduction in the cost to the U.S. in foodborne illness. So this is sort of the basis of why the law was done, was passed. FSMA standards have, as I mentioned before, many different components, and these are listed here on these bullet points on this slide. And the one we're going to discuss today is agricultural water. But you need to be aware that biological soil amendments, in other words, if you're using manure or some other way to fertilize, there are requirements for that, which I'm not going to talk about today. You need to be aware of worker health and hygiene. That one just boils down to the fact that if you have an employee or a farm hand that's sick, having diarrhea, for example, you obviously do not want them out in the field and potentially contaminating your product. Equipment, tools, buildings, and sanitation, that really boils down to the law requires that you maintain all the environments where you're processing to be clean. And domestic and wild animals, it turns out that cattle, for example, and wild animals carry some of these pathogens that are finding their way into the water. And so if you can limit access to your fields for these animals, that reduces that, and that's part of the law. And then there are specific rules for harvesting and packing, and I'm not going to go over those today. And then finally, sprouts are sort of a unique set aside because of increased risk for contamination of those of sprouts. What is the FSMA requirement for your farm? The law is being phased in, and the way in which it's being phased in is based upon your produce sales. So if you're a farm that has less than $25,000 in average annual produce over the last 3 years, you're exempt from the law. If you're a farm or business that is a very small business, and that's defined as $25,000, but no more than $250,000 in average annual income over the last 3 years, then you must comply with the law within 4 years, starting January 2016. Small business, $250,000 to $500,000, you must comply within 3 years. And then all other farms have to comply in 2 years. Those would be the large farm, very large farms. So it's important to remember that when I talk about this law going forward here, and I want to emphasize it right here, it's important to remember that this phasing in of the law requires you to test a baseline, and that's a 2-year baseline. So that shortens the time at which you have to comply. And we'll talk about that in a minute, but it's important to know that there are reasons why you should start looking at your water right now. I think it's really important because if you will find that you do have a problem, at this time you have the law gives you some time to see what you need to do to mitigate that problem or find out what it is and resolve it.
So, John, let me jump in right here because I know this is a little confusing, and it's really confusing for me. So let's say I'm a small farmer, so I do between $25,000 and $250,000 average annual produce sales. Explain to me exactly what the 4 years means and why there's a range. What exactly does that mean? Can you give me an example?
Yes, I mean the law is what they're trying to do is phase the law in for the larger produce farms and then back off from there to the smaller farms. So the 4 years to comply, I'm going to explain it in the next slide. So I'll just give you an example. So basically, if I have 4 years to comply, part of the law, which I'll explain in the next slide, is that you have to establish what's called microbial water quality profile. And that is essentially a baseline where you take 20 samples and you'll be able to identify what your average contamination level is. And that requires, like I said, 20 samples over 2 years. So if you have to comply in 4 years, at that time you should have that data.
Okay, so let's say that I'm a farm that's been around only for a couple of years. So the first year I was farming, I made less than $25,000.
Mm-hmm.
But the next year I was farming, I had a really good year, and I made $30,000. And then last year, because of the weather, I only made $20,000. How do I decide if I qualify as a small business or do I not qualify at all?
Again, you have to average the last 3 years' income, and that average is what determines which of these categories you fit into.
Great. Thank you. That's perfect.
Okay. So this slide is a slide that just sort of explains why there's different standards for different kinds of water and different kinds of produce. So basically, it is complicated, and this particular graph or table was actually taken out of the background research that the FDA did. So it's an FDA table in one of their publications, and it explains, I think, very nicely the complexity of the problem as to why, why this is not as simple as it might, you might think it was. So if you look at this table, if you at the very top, there's an arrow, and on the left-hand side, that arrow is green, which means that on that part of the table, you have the lowest possibility or probability of having contamination by a pathogen. And then as you move towards the right-hand side, your risk of contamination increases. So the arrow goes from green, which is least, to the right, which is most. Most likely is on the right-hand side. So if you talk about the source of your water, if you're using public drinking water is already regulated with very high standards. So basically, that's the safest water.
Do I still have to test that even though it's public drinking water?
The regulation states that you have to obtain the records from the public source and at least once a year to ensure that they are compliant.
Okay, so I need to get that from my water utility.
Correct. And then as you go across on that first column there, first row, if you're using groundwater is like well water, which is being pumped from the aquifer. That water tends to be pretty clean, although there are regulations for that in terms of, again, you need to test your well water once a year. That's a recommendation at least. And that groundwater, if you're using that for produce, there are specific regulations for you. And those I'll talk about in a minute. So, but basically, groundwater then is not as safe as public drinking water, but it's still considered to be less likely to be contaminated. Then on the next section of that row, you'll have surface water. If it's surface water that's protected from runoff, and you're collecting the water from that, which would be a stream or a pond or a river, whatever, and you don't have a lot of runoff into that, then that surface water is going to be less likely to be contaminated than surface water that is unprotected from runoff. And the reason for that is it turns out that in wet weather or in circumstances where you have runoff into the stream, that's where you increase your chances of the water becoming contaminated by contaminants being washed into the water. So that explains, why different water sources are going to have different regulations.
And does that change if it rains, or what causes runoff to maybe be good today, but next week it could be different?
It just depends on the degree of runoff and what your local environment is in terms of are you what kind of runoff you have. So, but in terms of the law, surface water is just has the same regulation in terms of the testing frequency, but really what this comes into play is when we talk about the two different analytical quantitative measurements that you're going to have to make, and I'll get back to this and explain how that comes into play here when we have those two analytical measurements. If you go on the lower part of the table, if you do have contamination, then the probability of that being a serious risk, again, depends upon the contact, for number one, with your commodity. So, for example, if you're if you're using drip irrigation, that's less likely to contaminate because it's not having direct contact with the fruit or vegetable you're growing. But if you have direct contact, say you're doing a sprinkler irrigation, then that's going to have a higher risk. So also, it depends on what you're growing. So there are certain vegetables that are, even if you contact them with a contaminant, it's unlikely for that to be infiltrated into the product. There are some that are not, the surface is not conducted to adhesion, so that's less likely to be contaminated. And the FDA decided this is really too complicated, so that part of it has not really come into play, other than the fact that there are certain products that are exempt from the law because, number one, they're not what's called a raw agricultural commodity. That is, they are a product that tends to be cooked, or they're one of these products that is less likely to have penetration. And that list is on that website that I mentioned earlier. Finally, there's the application and timing. So early in crop production, if you're irrigating, even if you have contamination at that point, it's low risk to actually be still there at the time you sell your product. But the farther you go along in terms of later in crop growth or during harvest, especially during harvest, if you contaminate during harvest, then it's going to be your product's going to go to the consumer, and that's going to be a high risk of contamination, and that's where the infection occurs. So during harvest and post-harvest handling is the highest risk.
And do you have to test in every single one of these sections? So do I have to test in an early crop growth, a later crop growth, then during harvest and post-harvest?
The law does not demand that you do that. What the law says is they would like you to test ideally early in the season and then close to harvest. And you need to have a certain number of water tests that are done during that cycle.
Okay.
So this slide shows you the E. coli FSMA testing requirements. Number one, right now, the way water is tested is by standard EPA methods. So it has to be done by a laboratory that are using those approved methods. So you need to identify a lab that does that. The water sample, when you collect the water sample, in order to avoid the killing of the organism, for example, if you were to send it on a hot day and packaging wasn't cooled, it would kill the organism. So in order to carefully ensure that what is being tested is really representative of what your water is at the time it was collected, it has to be transported to a lab, one of these labs, within 24 hours, and it has to be cooled. And so that's a logistical problem, and I understand that, and that's exactly why Visiogen is developing our product, which would totally avoid the cost of transporting the sample and the requirement for this laboratory. But again, that product is several years away. So right now you have to get your product to a laboratory within 24 hours in an insulated, cooled container with a cool pack or keep it cold. The specific requirements in terms of the water, when the water needs to be tested, or what the testing needs to be, is divided by when the water where in the growth cycle you're testing the water. So water that's during growth activities, what you need to do is initial microbial water quality profile, which is the myWQP. You have to do that for each water source that's being used for that growing of that crop. And if you're using untreated surface water, and again, remember, these are all, the basis of this is that table that I just went over, so that's why the difference is. If you're using untreated surface water, then you have to do 20 samples over 2 to 4 years as a baseline. And then you have to follow that up with a certain number of samples each year, which is on the next bullet down, the annual update of your myWQP. So if you're using surface water, you have to test a baseline of 20 samples over 2 to 4 years, and then you have to test additional samples, 5 samples every year.
So wait a minute, let me understand this just to make sure that I have it right. Let's say I'm growing asparagus, and I have...
Let me interrupt you right there.
Sure.
Asparagus happens to be one of those that is considered to be something people don't eat raw, and so it's exempt from the law.
Okay, that's...
So you need to pick the right... Let's say you're growing lettuce. Let's try that.
Let's grow lettuce, but that's good to know. So that's, you need to check to make sure.
That table, that's what I said.
Yep, that's really a good indicator. So let's say we're growing lettuce, and I have sprinkler water that comes from my utility, but I also have some surface water that I use that we collect in containers and use that during dry times. Do both of those have to be tested? Does the farm have to test every source, or does the farm have to just have random testing throughout the farm? So
yes, you have to test. I mean, you just described 2 different regulations. One is if you're using municipal water, that's a different. You don't. You really need to just go to your utility provider and get their record. Keep that record. But if you're using the surface water on that example, if you're using, let's say you have 3 different pump stations, and you're irrigating different parts of your farm from each of those pump stations. Each one of those pump stations would have to be tested.
Okay. And it sounds like maybe what we need to do is have you do a how to test the water from a pump in a later. Okay, that's what I needed.
So the second category here, to get back to this, is the untreated groundwater. And remember, groundwater is less likely to be contaminated, so the law requires fewer samples. So if you're using well water, for example, you would need to test 4 samples over a year to establish your myWQP, your microbial water quality profile. And then you would need to annually just test 1 sample. So less stringent requirements because that particular water sample is not as likely contaminated. The only other thing the law states is the sample that you're testing should be, well, at least one of them should be as close to harvest as possible. If you have water that's used during or after harvest, and you need to test that, and you're using untreated groundwater, then again you need to do 4 samples over a year and then 1 sample per year.
So where would you give us an example of where you would use untreated groundwater after harvest?
If you're washing your produce, let's say you're growing potatoes and you're washing those potatoes or onions, then that water needs to be tested, and that will be under its category.
Does drinking water, if you are not drinking water, hand washing water for sanitation have to be tested?
It depends on the water that's being used. If it's municipal water, then again, that's already protected. If you're using surface or groundwater, then it has to be tested according to regulations. What are the acceptable water criteria? So once you do send this in, you've done your testing, you've sent in your sample on ice or pool to a laboratory. What are the criteria that are then used to determine if it's acceptable? Well, it turns out that in the water industry, there's an organism which is called generic E. coli. All of us have it. It's a contaminant in your feces. It's an organism that's naturally there. It doesn't cause infection. It's not a pathogen. But that organism is an indicator, if it's found in water, that somewhere there has been contamination with feces. And that could be animal feces, like from cattle, or human, or wild animals. But regardless, if that organism is there, it's a surrogate marker. It just says there's a warning here that there's a potential that your water is going to be contaminated with. So that's what's used. And the standards that were developed for FSMA are really based on the same standards that the EPA uses for environmental water testing, recreational water testing. So for produce, if if you have the produce that is being contacted directly post-harvest, your standard is that the water should have no detectable generic E. coli if you're to test 100 milliliters. 100 milliliters is about the size of a standard glass of water. So if you take that amount of fluid, you can have no detectable E. coli in that if the water is directly contacted with produce and it's during post-harvest washing. For growth activities, then they have two different ways in which measurements are done. Again, it uses E. coli as the surrogate marker, but you count the number of E. coli that are in a water sample. So they do, again, the same volume, 100 milliliters of water, and that has to have a geometric mean of less than 126 CFU. CFU stands for colony forming units. So when they grow this, they grow the E. coli in a laboratory. They grow it on a surface where they can identify each individual cell by the fact that it grows into a colony that's counted. That's what CFUs are. It's just a way to quantitate. So, but the geometric mean is essentially an average. It's not exactly. It's got a different mathematical formula a little bit, but basically it does measure your average count. And so that's why that particular standard is used. And in addition to that, you have to measure the statistical threshold value, or STV. And the STV has to be 410 CFU per 100 or less of E. coli. And why the two standards? Well, a statistical threshold value reflects the variability in the water. So, as I already mentioned, it's well known that after a rain or some runoff condition, you will have fluctuations in your water. There will be fluctuations in the counts of E. coli. So there may be certain times of year or after certain weather events where you're going to have a spike in your E. coli, and it's going to go above the 126. So what that does is it accommodates for that, so that if you have a specific sample that spikes, it can't spike above 410 CFU. So that STV, the analytical measurement, allows you to identify it's the 90th percentile of the values that you're testing, and that measures those spikes in the counts. that clear to you, Jim?
Yeah, that is.
Okay.
But I will tell you that having to do the math part, I think, is really, really hard for anybody that's not a finance person. So,
well, that's why we have at Vizigen come up with the program that we have, because the program we'll be briefly describing at the end of this webinar automatically does those calculations, so that, and the laboratory values are automatically populated into a database that does all of the work for you, so you don't have to understand other than just looking at the numbers that are given to you and knowing those two cutoff points.
And I assume you're going to have webinars talking about if the numbers are high, what to do, things like that, or you can always ask the question. So this is a good time to say, as you're hearing this, if you have questions, John said briefly at the beginning, if you go to www.h2oprofile.com and put your questions in our blog, we will be happy to answer your specific questions. And then what we'll probably do is do a FAQ for the group so that everybody can benefit from your questions. So don't think your question is not relevant to other people. We will take all those questions and then publish them so that everybody can take advantage of learning from each other.
Yes, absolutely. All right, so we've explained the law, the requirements of the law, and the specific values that are required for compliance and for acceptable water. Now that you've collected all that data, you've done your baseline study, and you're getting values each year, you need to keep records. So part of the law requires specific record keeping requirements. So, and that's what this slide is explaining. So the record has to be created at the time the activity occurs. So you need to test your water when that water is being used for irrigation or whatever purpose you're using it for. That has to do with your produce at that time. It has to be accurate, so that's where you have to do the correct calculations. It has to be legible, indelible, it's got to be dated, it's got to be signed, or initialed by the person that's performing the documentation. And that documentation also includes, you have to include the name and location of your farm, the actual values and observations that were obtained during the monitoring, an adequate description of the produce that you're addressing with this record, location of the growth area, what specific plots being used as part of the field, the date and time of the documented activity.
So that's the sampling.
Yes. And also you need to record how long it took for the sample to get to the laboratory. So that's the transport time. The results must be reviewed. Once you get those back from the laboratory, somebody has to look at them, and somebody has to sign to say they did look at them. And that has to be a supervisor or whoever's responsible for your business. Those records need to be retained for 2 years, and they have to be readily accessible. The FDA, they have the right under this law to demand that you produce those records in 24 hours after they ask for the records. So these are all pretty onerous requirements. And again, what we'll just discuss in terms of our water profile we've set up is we have a way in which it can be simplified to simply taking a picture at the time you collect your water, and then everything else is automated with digital signatures and storage of data for 2 years. So it's always there. You can get it whenever you need So let's summarize what we've talked about today. So basically, the new law says you need to test your water sources that are used for produce. You have to collect your water sample and deliver it to a lab within 24 hours, and it has to be cooled, so in an insulated container. You have to follow all of the record-keeping requirements and have those readily available on demand to the FDA should they request them within 24 hours. All those records need to be, the records and results need to be maintained for at least 2 years. They need to be signed. All the test results need to be signed that you, at the time you did the testing, and signed by the reviewer who reviewed the results. You need to accumulate in your database the geometric mean values and the statistical threshold values as well. So again, I just want to emphasize that Vizigen is developing a one-stop solution that's a simple solution that I think will really benefit the community and make compliance with this law simpler for you. And that's at this website, at www.waterprofile.com. So you can go there, and it's a membership site where you can join that membership and have access to these services. And there will be a separate webinar where we will explain exactly how you can sign up, how you can use that service. There are a number of benefits that we see for this the Water Profile myMWQP membership. Mainly, it's just convenient. It's convenient, an accurate way to document and test. All of the records are it's automated in terms of the record keeping. It's maintained on
a daily basis. It's
backed
secure.
up. It's backed up daily. It's secure, and basically it's maintained in an area where it's always safe. So you're not going to lose it or have a problem. Say your own personal computer goes down. That's not a problem. It's going to be in the cloud. And what the site does is it expressly documents all of those requirements that you need for record. So you take a picture, and that links your site automatically by the GPS location on your phone, so that it specifically locates where you took the sample within 20 feet. It verifies the transit time because linked on that picture, it was recorded at the time it was taken. And then we have participating laboratories where when they get that sample, all they need to do is plug in the specific picture code. Every picture you take has a unique code, and that code then identifies or calculates how long it took for the sample to get to the laboratory. Then they do their testing, and they also, using that code, will upload all the data through that code specifically to your own private membership area. Nobody sees any of this data except you. It's your area. And that photo automatically links to you specifically to that specific result. So there's no confusion in terms of whether or not the sample result is linked to the correct sample. That also, the lab result then auto-populates into a form, and the form gives you the geometric mean and the statistical threshold. One thing I didn't really explain on these values are what the law says is you have to do that first 20 samples, which is your baseline, and from then on it needs to be a rolling average every 5 samples. So you do 20, and then if you do 21, then it's just the last 5 samples. So that makes it even more complicated. But our program automatically does it for you. enters the E. coli results, and then it is, once you get the lab result back, it's populated into a PDF form, which you then just digitally sign, and that is saved into the database that's backed up every day. So this system is very simple. It satisfies all the FDA result documentation requirements. It's always retrievable. It's backed up and saved. The results are private. Only you see your results. They're specific to you. They're secure, and they're archived. You will archive them for you for the 2-year period. As we grow this membership, what we hope to do is, as we get more and more members, negotiate discounts for laboratory services, discounts on courier services, and then ultimately, as Vizigen's product is completed, that whole database would be used for our product, and the only difference meaning you're going to eliminate all of that transportation, delay, and cost.
So you would be doing your own testing on your farm, and you wouldn't have to send it in?
Correct. The ultimate test, you're going to be able to do the test on a little chip that then you record the results. It's recorded with the cell phone, and once it's recorded with the cell phone, that's going to link right into the software for this database. It automatically gives you everything.
And what's the time frame on that as far as once you put that water, how long would it take to get the results? Will it take the same 24 hours?
No, it's going to take 30 minutes. Between 30 minutes and an hour is
great.
All right. Well, I think that concludes this webinar in terms of what we wanted to cover today, and I hope that it's been informative and of use to everyone who's viewed it. So if you do have questions, though, remember you can go on this site here, the http://waterprofile.com, enter your questions on our blog, and we'll be happy to get back to you with the answers.
So, John, we want to thank you for taking the time to do this. As you heard a little bit about what he's working on for the future, that kind of gives you the understanding as to why John's very interested in how this water rule gets taken care of and making sure that people can adhere to it until there's a better solution, and he's hoping that better solution will happen sooner than later. And so that's really great. But meanwhile, we want to help people and also learn a lot about what your difficulties are and use John as an expert in the water safety world so that you have somebody you can ask questions to, bounce them off. Yes, we would love to have you become a member, but if that isn't something that you choose to do right now, we will have information. So go to our website, as John said, read our blog, see what's going on there, see if there's any changes. There will be additional webinars on other related areas to the water safety requirements, not only how to do the website, but whatever things come up. And I just have one quick question for John that I have, which I haven't asked him, so it's really not fair. It's kind of a loaded question. But that is, if the requirements change with the FDA, would your membership site change to support, can you program in other pieces and parts if needed for that site to comply if things change over the next year?
Absolutely. One of the reasons I'm doing this is I'm developing a product where it's really critical that I'm on top of exactly what's going on. This is a new law, basically as the law is implemented, there may be changes and certainly interpretations and so forth. So absolutely, we'll keep up on it.
Yes, so we want to make sure that you realize this is not just a one-time, you hear from John. John will be actively involved in this community, in what the water safety regulations are. The other piece that I hope everybody heard pretty clearly is the sooner you start testing, the sooner you can start to build the database that you need, which is really important. And if you don't understand how to do it, what to do, we will have this so that you'll be able to listen to it or have your team listen to it, or new people who are working for you during harvest time. We want to make sure everybody gets the information. So this is Jill Leifhart, and thank you for listening to what Visigen Global has to say. Please visit us at h2oprofile.com. Leave your questions on our blog, and we hope to hear from you soon.